Alright, so there are four parts of the aorta. There's the ascending aorta, the aortic arch, the thoracic aorta, and the abdominal aorta. The one that branches from the ascending aorta is the coronary artery, and it just supplies blood to the heart. The aortic arch, what branches off the aortic arch is the brachiocephalic artery, the left common carotid, and the left subclavian. The brachiocephalic artery supplies blood to the right common carotid, or the head, and the right subclavian, which is the arm. The left common carotid supplies heart to the external and internal carotid, and the left subclavian supplies blood to the left arm. The one that branches from the thoracic aorta is the intercostal arteries, which supplies blood to the rib cage. The one that branches from the abdominal aorta is the celiac trunk, which supplies blood to the gastric and the splenic and the common lymphatic. The ones that branch from the celiac trunk, which was the gastric, splenic, and common lymphatic, the gastric artery supplies blood to the stomach, the splenic artery supplies blood to the spleen, and the common hepatic artery, I put lymphatic, but it's hepatic apparently, supplies blood to the liver. The ones that branch from the abdominal aorta are the superior mesenteric arteries and the renal arteries, the inferior mesenteric arteries, and the common iliac arteries. The superior mesenteric artery supplies blood to the intestines. The renal arteries supply blood to the kidneys. The inferior mesenteric arteries supply blood to the intestines. That's interesting. The common iliac arteries supply blood to the pelvic girdle and the lower limb. Now, the external iliac and the external and internal iliacs branch from the common iliac arteries. The external iliac supplies blood to the lower limbs, and the internal iliac supplies blood to the inner pelvic girdle. The femoral artery branches from the external iliac, and it provides blood to the leg. So, if you're a red blood cell leaving the ventricle through the aorta en route to the legs, first you would pass the coronary arteries, then the brachiocephalic trunk, then the left common carotid artery, then the left subclavian artery, then you would go to the intercostal arteries, to the celiac trunk, to the superior mesenteric arteries, to the renal arteries, to the inferior mesenteric arteries, to the common iliac arteries. Let's say if you were going to the left side of the head, you would go from the left ventricle to the aortic valve, to the ascending aorta, to the aortic arch, to the left common carotid, to the left internal and external carotid. Let's talk about veins. The vessels that merge to form the superior vena cava are the right and left brachiocephalic veins, which the three are the subclavial veins, the internal jugular veins, and the external jugular veins. The vessels that merge to form the inferior vena cava are the right and left common iliac veins, which can be broken down into the external iliac veins and the internal iliac veins. The major veins leading to the inferior vena cava are the renal veins from the kidney and the hepatic vein from the liver. Hepatic portal circulation is important for pharmaceuticals because it's the one that carries blood from the GI tract and the spleen to the liver without going to the heart, which allows the liver to modify substances absorbed into the blood from the GI tract. So it uses the lymphatic portal veins. So that's the one that she was saying it would go to the liver first, and then it would go into the blood. Alright, here are some veins. The coronary sinus collects blood from the heart and sends it to the right atrium. The superior vena cava collects blood from the head and arms and sends it to the right atrium. The inferior vena cava collects blood from the lower part of the body and sends it to the right atrium. The internal jugular veins collects blood from the head and sends it to the brachycephalic vein. The external jugular vein collects it from the head and sends it to the brachycephalic vein. And the subclavian veins collect it from the arm and sends it to the brachiocephalic vein. The brachiocephalic veins collects it from the head and arms and sends it to the superior vena cava. The common iliac veins collects it from the lower limb and pelvic cavity and sends it to the superior vena cava. The common iliac veins, that was the lower limb and pelvic cavity one. The renal veins collect it from the kidneys and send it to the inferior vena cava, and the hepatic vein collects blood from the liver and the abdominal organs and sends it to the inferior vena cava. So, that's all the vein stuff is the blood going back to the heart. So we tracked it on the last one going to the body part. Now we have to track it going from that body part back to the heart. So if we're going to say, let's say the stomach, it would have to go through the hepatic portal vein to the liver, to the hepatic vein, to the right atrium. The kidney would have to go through the renal vein to the inferior vena cava to the right atrium. The right side of head would have to go to the right external or internal jugular veins, to the right brachiocephalic vein, to the superior vena cava, to the right atrium, and so on.